Good morning, distinguished guests. I'm Jian from Singapore, and I'll be presenting our research on the 4 years outcomes for intraoperative cell-salvaged autologous blood transfusion in metastatic spine tumor surgery. This is a single-center experience from our institution. No interest to declare. So the first thing, why do we embark on this project? It's shown that in metastatic spine tumor surgery, blood loss is significant, up to 2 liters. In our institution, we did a retrospective review, showed that there's up to 1 liter, 900 mils to 1 liter of blood loss, and this depends on the primary tumor and surgical approach done. So we have done a review that also showed that patient blood management is very important in metastatic spine tumor surgery. And in fact, allogenic blood transfusion is still the mainstay blood product in replenishing blood loss intraoperatively, but it's not without any complications. We show that there's significantly higher complication rates in patients with allogenic blood transfusion compared to salvage blood transfusion. And hence, IOCS is shown to be a good alternative for blood replenishment. It's used in spine surgery, scoliosis, degenerative conditions, but has kind of yet to find its place in metastatic spine tumor surgery. And this may be due to the previous myth that IOCS was kind of reinfusing malignant cells in tumor patients and hence promoting tumor dissemination. But we have done multiple meta-analysis as well as biochemical studies, which shows that there's a safety profile of IOCS and there's minimal to no tumor cells present in the salvage blood. Our study hence aims to first validate the clinical use of IOCS in MSTS patients, and this will be the first prospective long-term study on the use of intraoperative cell-salvaged blood transfusion in metastatic spine tumor surgery. We hypothesize that because there's 0 to less circulating tumor cells in the patients, reinfusion of this IOCS blood actually does not affect disease progression as well as survival. So this was our study. We've done a prospective study conducted about 4 years. We divided the patients into 3 groups: no blood transfusion, allogenic blood transfusion, as well as salvage blood transfusion, and followed them up to 4 years or death, whichever was earlier. These were the data collected and our results. Okay, so we showed that the demographic of our patients-wise, we have a total of 98 patients across the groups. There was no significant difference between their demographics. In terms of blood loss and blood transfusion, it was also comparable across the 3 groups. We split them also into their primary tumor type based on their vascularity, which we analyzed for overall survival later. And this is the results of the overall survival, mainly highlighting at the top circle that salvage blood transfusion had a slightly improved or reduced risk to death as compared to allogenic blood transfusion. We show that for total blood loss, as highlighted here, there's a slightly reduced risk of death compared to the allogenic blood transfusion group, which I'll explain later. And this is our Kaplan-Meier curve, which shows that across the 3 blood transfusion groups, there's no significant difference between the overall survival between them. When we split them into the vascularity, as shown in previous papers, it's shown that for the highly vascularized patients, there's a significant risk of death, and hence we should take more caution when operating on them. For tumor progression, this is quite a lengthy, elaborate slide. Mainly signifies that in spite of splitting the patient and doing analysis in terms of their gender, race, level of decompression, there was no significant factors that actually affected the overall tumor progression in our cohort. And this is the competing risk regression, which shows that there's no significant differences in terms of overall tumor progression within the 3 groups. In complications-wise, between our 3 groups, there was all comparable and no significant differences between the 3 groups. So salvage blood transfusion has shown to be safe without any increase in overall risk of death or tumor progression, unlike what was contrary mentioned in the past. And this is shown now, even on long-term clinical follow-up in a prospective study. We showed there's a slight decrease in the risk of death compared to allogenic blood transfusion and salvage blood and no blood transfusion. And this may be because for salvage blood transfusion, there's no immunosuppression, unlike in allogenic blood transfusion. We also show that tumor vascularity, there's a correlation between that and overall survival, and subgrouping them between the highly vascular, moderately vascular, and the other groups actually showed that the highly vascular tumors had a significant increase in death, but no association with tumor progression. And this might be because tumor progression is inherently due to the oncological characteristics of the tumor instead. Lastly, we showed that every unit increase in the log scale of blood loss, there was a slight decrease in death. And this may be due to, in our institution, we undertake debulking surgery such as partial near total corpectomy, which aid in more extensive removal of tumor material and hence improving the overall survival. Just last conclusion, we showed that salvage blood transfusion is safe. Patients have a slightly lower mortality rate 4-year follow-up compared to allogeneic blood transfusion. This is comparable. And the study validates the overall long-term clinical safety and efficacy of salvage blood transfusion, which should be used in all MSTS institutions in the world. Thank you.